Hello, I'm Beth Wagner, physical therapist. In this video, I'm going to show you 3 excellent exercises to decrease pain due to lumbar facet joint dysfunction. Now, typically, dysfunction or inflammation of the facet joints in the lumbar spine causes achy pain, specifically on one side of the low back. Sometimes this pain radiates into the buttocks, thigh, or groin, but it always stops above the knee. Pain is usually worse with lumbar spine extension, meaning arching the back or leaning back, and with side bending to the side that's affected. Pain is also frequently worse with standing still and sometimes with walking. It usually feels better with flexion, bending or flexing through the spine. Now, this pain is typically due to degeneration or an acute irritation or inflammation of the facet joints in the lumbar spine. Once the label of degeneration in the spine is given, oftentimes people can feel defeated. They feel like something is broken in their bodies and that there really is very little chance for healing and recovery. One of the important points I want to make in this video is that we have more power than we think to change our bodies and restore health. The first step in addressing facet joint dysfunction is decreasing inflammation, which will help to calm down the tissues and nerves and allow our bodies to do what they know how to do in order to heal. Now, if the pain has come on due to an acute injury within the last 72 hours or 3 days, then it's important to apply cold therapy and to rest. Now, I've posted another video on treating acute injuries, and I'll post the link somewhere up here in the video and in the description below. So check out that video and be sure to rest and ice your back. Take good care of it for the first 3 days or so, and then come back to this video and pick up where you've left off. Now, after 72 hours following injury, bed rest has been shown to not help and may actually cause further issues. The best treatment is gentle movement to lubricate all of the joints and to improve blood flow throughout all of the tissues in the area. Movements need to be gradually progressed in order to return to daily activity and exercise in order to rebuild strength and flexibility without causing strain, re-injury, or further irritation. Okay, so now let's get to the exercises. All 3 of these will be performed lying down, and I'll show you modifications of them as we go along. All right, the first exercise is single knee to chest. Lying comfortably on your back with your knees bent and your feet flat on the table. We'll bring one knee up toward your chest. Again, this should be gentle to start with, and use your hands to support your leg. Bring your knee towards your chest just as far as you feel comfortable. This should be pain relieving. It should not increase your pain. Hold for about 5 seconds and then bring your foot back down to the surface. Repeat on the other side. Lift your knee and use your hands to support your leg and bring your knee closer to your chest. All right, after about 5 seconds, bring your foot back down to the surface and switch legs. Lift the left leg up. Use your hands to gently bring your knee towards your chest. After about 5 seconds, slowly lower your foot to the surface. And again, on the right leg, bring your right knee up. Use your hands to guide your knee towards your chest gently. Exhale as you bring your knee in. After about 5 seconds, slowly lower your right foot back down toward the table. All right, the first progression of this is to lower the other leg while your knee is in toward your chest. So when we bring the left knee up toward the chest and give it a gentle hug, I'll slowly lower my right leg down so that it's straight. Again, if at any point this causes increased pain in your back, especially a sharp shooting pain, stop, don't go so far. Back out of the stretch slowly and don't try this progression quite yet. All right, after about 5 seconds, bring the right knee back up, foot flat on the surface, then lower the left leg slowly onto the surface. Slow and smooth motion is key for these exercises. All right, now on the right side, bring the right knee up towards your chest. use your hands to guide the knee in. When you're ready, slowly lower your left leg. Slide your heel out until your leg is straight or as far as it feels comfortable for you to move. Continue breathing in through the nose, out through the mouth for about 5 seconds, and then slowly lift the left leg back up, foot flat on the surface, and then slowly lower the right leg again. Whichever variation you choose, perform 10 on each side, or as many as you feel comfortable starting with. The first time you do this, maybe 1 or 2 is enough. As you get used to it, as you begin to recover, gradually add more repetitions. All right, the next progression may be a bigger leap, and you might want to do this after several weeks of recovery and healing time have passed. All right, this progression is a double knee to chest. We'll start with the single knee to chest, bringing one knee up toward your chest, giving it a gentle hug. Make sure you're breathing. Now bring the other knee up. Use your hand to guide it in towards your chest. And just relax here. This should feel like a comfortable stretch through the low back, possibly into the buttocks, but this should not cause any sharp shooting pain in your low back. All right, after about 5 seconds, or however long it feels comfortable to hold it, lower one foot at a time. This is very important. Lower one foot using a hand to help support your thigh, and then lower the other leg. Good, and let's repeat. I'll show you the opposite way this time. We'll bring the right leg up first, give it a gentle hug, then slowly lift your left leg up. Using my hand to guide my leg, I'm going to support my legs with my arms. Continue breathing. And after about 5 seconds, I'll lower my left leg first, using my hand to help lower my leg. And then the right hand will help lower the right leg. And relax. Number 2 is posterior pelvic tilt. Again, starting in a comfortable position, lying on your back, with your knees bent, feet flat on the surface. Have your knees and feet about hips distance apart. Now, engage your lower abdominals by pulling your belly button up and in toward your spine. You should feel the muscles deep in your abdomen firming up underneath your fingers. If you can. If you don't quite feel that, that's okay. Do your best. The next step is to tighten your gluteal muscles and press your low back down into the table. So the top part of your pelvis is rocking backward, which will flatten the curve of your lumbar spine. You might feel your buttocks coming up off the table a little bit, and that's fine. But this is not a bridge exercise where we're lifting all the way up. That's not what this is. This is simply a posterior pelvic tilt. We're keeping your body firmly on the table, and we're just opening up the lumbar spine, letting the curve flatten and round down into the table. Okay, let's do that again. Place your fingers on your lower abdomen and engage the abdominal muscles and roll your pelvis back to flatten your low back down into the table. Pause. If it's comfortable for you to hold this position for a few seconds, maybe 3 to 5 seconds, that's great. If not, don't hold it. And gradually release. Good. Now let's try matching our breathing with it. Inhale first through the nose. And then as you exhale, tilt your pelvis back, round your spine into the table. Engage your abdominals, engage your gluteal muscles. Pause for a few seconds, and then release. Okay, continue moving in and out of the pelvic tilt with slow, smooth motion 10 times. Choose the pace that feels comfortable for you. The slower the better to start with, As you heal, as you begin to recover and your pain subsides, you could move a little bit quicker if you'd like, but this should always be a slow, smooth, mindful movement. Okay, exercise number 3 is bent knee fallout. Starting again, lying on your back, knees bent, and your knees and feet about hip distance apart. Can rest your hands either along your side, on your abdomen, on the front of your hips, wherever you're comfortable. And inhale to prepare. And then as you exhale, slowly lower one knee out to the side, keeping the other knee pointed up toward the ceiling. And just lower your leg as far as it feels comfortable. Pause, and then come back up on your inhale. Again, exhale, lower the knee out to the side, the other leg now. And pause there. Slowly lift your knee back up to the starting position. Exhale, lower the left knee, pause. Inhale, bring the left knee back up and switch sides. Exhale, lower the right knee down. Pause. Inhale, bring the right knee back up. Now, if this is painful in your low back, then reduce the motion just to the smallest amount. So start with an exhale, slightly moving your knee out and bring it back up. Switch to the right side. Move it just a few degrees out and bring it back up. And repeat. Continue alternating the left and the right sides. Perform 10 repetitions on each leg, alternating left and right sides. I also encourage you to check out the other videos in my low back pain video series. The link to that playlist is included in the description below. There are many other exercises that might be helpful for you included in those other videos. These 3 are my favorite 3 exercises to start with for facet joint dysfunction, but there are many other exercises that could be beneficial once these are tolerated. Okay, that wraps up this video. I hope you found these exercises helpful to decrease pain in your low back due to facet joint dysfunction. If you like this video, please give it a thumbs up and subscribe to my channel. That helps me, and it also tells YouTube that this information is valuable so that it can be shared with more people who will benefit just like you. Here's to your healing, health, and happiness. Have a wonderful day.